My name is Chloe Whiteside, and today on Antibiotic Answers, we're going to be taking a dive into strep throat. If you have any questions or concerns following this presentation, please feel free to reach out to Emily Perry at NDSU's CAP Center at any time. Her email is emily.perry, so that would be emily.perry@ndsu.edu. So first, how can Group A streptococcal pharyngitis, also known as strep throat, be treated with oral antibiotics? So before any treatment occurs, we need to receive a positive test for strep before giving antibiotics. This also means that we should not treat family members without them also testing positive. Our first-line oral antibiotic agents would be penicillin V or amoxicillin. So first we'll go over dosing for penicillin. The child dose recommended is 250 milligrams twice a day or 3 times a day for a total of 10 days. The adult dose would be 250 milligrams 4 times a day or 500 milligrams twice a day for 10 days. With amoxicillin, it is a weight-based dose, so we would see 50 milligrams per kilogram once a day or 25 milligrams per kilogram twice a day for again 10 days. Now we will talk about how can we treat if there is a documented penicillin allergy. If someone has an allergy, other oral antibiotic options might include cephalexin, 20 milligrams per kilogram per dose, twice a day for 10 days, cefadroxil, 30 milligrams per kilogram once a day for 10 days, clindamycin, 7 milligrams per kilogram per dose, 3 times a day for 10 days, azithromycin, 12 milligrams per kilogram once a day for 5 days. So this is our only one listed that is not that 10 days per guideline recommendations. And then clarithromycin, 7.5 milligrams per kilogram per dose twice a day for 10 days. Now, how can we treat resistant cases of strep throat? This will differ from community to community, so that's important to know. But currently we are seeing that in parts of northern North Dakota, we see a high resistance or non-response to amoxicillin and azithromycin. So those are some things that we might want to consider when we are changing therapy. So for patients who don't respond to initial treatment, so maybe one of those first-line antibiotics, or if they've been given azithromycin, for example, or any other agent, if they have recurring strep, they could be treated with one of the following options. So first, they could be treated with a longer duration of antibiotics. Recently, we've seen some studies that have been suggesting antibiotics for only 5 to 7 days instead of that guideline recommended 10 days. So if a patient does fall into this group and their symptoms are persisting, we might want to start with trying to extend to the full 10 days of therapy. If that doesn't work, or if we want to try something different, we could also try giving an antimicrobial that is not inactivated by penicillinase producing organisms. So that might include an augmentin instead of just an amoxicillin, switching to one of those cephalosporins that I listed on the allergy list. Or if there is a severe allergy, maybe trying a macrolide, and since we've seen resistance to azithromycin here, one of those might be clarithromycin. Again, the dosing should be noted on that penicillin allergy slide that I already touched on. Again, if you have any further questions after watching this video, please feel free to reach out to Emily Perry, and here are the sources that I used for today's slides.